I believe that we will get to share many more things together. So please, can we see my slides?
Not yet.
Okay, all right, that's great. All right, so quickly, um, we'll talk about diabetes mellitus, and generally, we'll just talk about what it is, the how rampant it is, the risk factors, the complications, and how to prevent it. You know, so basically, what is diabetes? And in a very simple way, diabetes just means that the body is not producing or properly using insulin. You know, the body has insulin, and it is what allows the body to control the glucose that we get from our food, which converts to energy. So I was talking to some group of people lately that every time we eat food, whether it is a bar, rice, fufu, dodo, anything we eat, it eventually goes into your stomach, and from your stomach it's digested, it enters into the intestine, and while it is undergoing some digestion, and then we now that food, a lot of it is converted to glucose. Of course, many other things, but let me just be simple and say a lot of it is converted to glucose. And in the intestine, that glucose is absorbed into the bloodstream. And when it gets absorbed into the bloodstream, now you have plenty of glucose there. You have to use it for something. A lot of it goes to, yes, into muscles where they are used up, and then some will go to the brain where they are used up also. Then, of course, to other places too, but I'll keep to those two and say that yes, when there is excess of it, it goes to the liver where it is converted into a storage form. We call it glycogen, and then excess of it is stored as fat in the body. So I've talked about two things that it is used for, mainly in the muscles and in the brain. And I talked about two places where it is being stored, that is in the liver and in the fat cells. Now I'm giving a very oversimplified, you know, description of how glucose is being used in the body. However, before the body can do all of these things, it needs insulin. Insulin is like a key, it is produced. In fact, insulin is produced from the time that you sight your food. By the time you sight the food, sometimes like Pavlov experiment, by the time it's break time, insulin is started being produced, anticipating that you're going to eat and that you're going to bring a lot of glucose into the body, and then it has to take care of it. So once the glucose gets into the body, the insulin is produced, is produced, and that insulin is what makes it to go into the muscles where it is being used. It's the insulin that is required for it to go into the storage system that is in the liver to mop it up. So once you eat your food, it enters into your stomach, it enters into the intestine, the blood, the food is being converted to glucose, and the glucose is being absorbed into the bloodstream. Insulin has started coming up, and it is trying to mop it up because the body needs to have a let me say the body needs to have a normal level of glucose. It needs a normal level of glucose. When it is too high, it's a problem. When it is too low, it is a problem. So it has to keep it a normal level. In our own Nigeria here, we use between 60 milligrams per DL to 100 milligram per DL. That is what the normal glucose should be. So when you eat food, when you eat food and you just ate the food now, after some hours, the sugar will spike. It can go as high as 140, 160, 180 in some people, and then the insulin start working and start mopping it up to bring it down to between 70 and 100. And when you are hungry, maybe your sugar has fallen down to about 50, 60, 50, 40, 30 milligrams per DL, you feel very hungry. And then triggers the body will say, yeah, you need food, you need food, you need food. And then that's why you go and eat food. So basically, the body needs a normal, level of glucose. And it is, and diabetes means that something has gone wrong. It's either the insulin is not giving the control. Maybe it's not available or when it's not working properly, you know. But the important thing is that when the body does not produce or properly use this insulin, then we will not be able to control our blood sugar. Now, insulin is produced as at, or it is secreted as at when needed. You can see that when you eat, that's when glucose will come into your body and it will be plenty. So that's when you need the insulin. Of course, you need some baseline, but that's when you need some spore spiking of that insulin to say, oh yes, let me, food has come, glucose has come. Let me ensure that this glucose is used properly so that it will come to normal value. I hope we are all with me, and I have not over spoken too much medical grammar. So we have a couple of types of diabetes, you know, and we have type 1, we have type 2, and we have type 3. And we have gestational diabetes, I mean. And then we have many other ones anyway, but I'm not going to talk about that because I want to keep it as simple as possible. So I'm going to keep to those three types. So type 1 occurs, in fact, today I'm going to even emphasize more on the type 2 diabetes mainly. But type 1 usually occurs in children and in young adults. And basically what happens is that um, the body is not producing insulin. It's just not producing enough insulin at all. That either it's not producing at all or it's not producing insulin. So when the person eats, the blood glucose in the body will rise. I said it's going to be between normal is between 70 and 100. So this can rise up to like 150, 180, 200, and there is no insulin to bring it down wherever to make it go into the muscles where it will be used, to make it go into the liver where it will be converted to storage or to other places. It will just be flowing in the bloodstream, just like that. And that causes danger. And that is what is causing the problem. But we are not going to talk much about that. Whereas in type 2, which is the common one, and it is usually diagnosed in adults, especially people in our age group, at least 40 above, that's where it's common. And in this case, the main problem is that, yes, insulin is either being produced but not enough for the amount of glucose that person has eaten, or the insulin is actually being produced, but the insulin is not working. It's just like you went to use fake insulin or fake drugs. You understand? It's either that okay, the body is producing fake insulin, or the insulin is not just working one way or the other. So by and large, it's just like, oh, when you eat and there's a lot of glucose in the system, it has gone up to 140, 180, 200, and the insulin that is supposed to mop it up to either make it go into the blood vessels or to get it to storage is not working. So the thing will just be high there and it will not come down. And that is the bad part. And then we have the gestational diabetes. Gestational diabetes basically is almost like type 2, but the thing there, like, it occurs during pregnancy. The first time it will occur is during pregnancy, and it is because pregnancy has a lot of hormone imbalance and stuff like that that make it come up. So by and large, what the basic thing is that we are not having enough insulin one way or the other to control the glucose that enters into our blood after meal. So I will quickly talk about the concept of pre-diabetes. Very, very important. And this is before somebody starts having diabetes, which we say that, we say normal is between 70 and 100 milligrams per dl. So before we say somebody is diabetes, we will say that the blood sugar is above 126 milligrams per dl. So the question now is that what of those between 100 and 126? So what do we call them? Obviously, they are not normal, but yet they are not yet diabetes because we call diabetes 126. So when they are between that value, we say that they are pre-diabetic. And that's a very, very important group of people because when somebody is able to diagnose or quickly catch the person when he's still in a pre-diabetic state, then we can prevent the early onset of diabetes in that person. So what I mean is that so we can make slow down the process of the person either becoming diabetes or in fact sometimes it may delay it so much that the person might not even become diabetic in his lifetime. So 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 and that is why that in fact that's the whole essence of this lecture, that while people are pre-diabetic, let us catch them young, and start medication. You know, there are other means of deciphering pre-diabetics like HbA1c. Also, is a kind of test that we do to check blood glucose. And then there's other glucose oriented. But I don't want to dwell so much on that because time is of essence, and I can't talk too much about all of those other things. So, how prevalent is diabetes in Nigeria? Yes, we have difficulty with data, but all we know is that between 3.7% or 7% of Nigerians have diabetes. And if you look at Nigerians being about 200 million estimates, if you say 7% of 200 million people, we are talking about 14 million people. 14 million is a lot of people. Just imagine 14 million people having a disease is a problem. And unfortunately, many of us don't know. In fact, many Nigerians don't know that they have diabetes, and that is why lectures like this are important. More importantly, about 12% are pre-diabetes. That is, they are not even yet diabetes yet. They are not up to part of the 14 million people that will say they are diabetic. They are just like, oh yes, they are in between normal and abnormal, and they are there. And look at the about 12%. That is roughly 24 million people. That is a big number of people. And those are the people that we are trying to target to bring so that we can know what to do about it. So, what are the symptoms of diabetes? Um, okay, I think I have about 15 more minutes, so I'm going to be a bit faster. So, what are the symptoms of diabetes? So, the person becomes very thirsty and he urinates a lot. Thirstiness and excessive thirst, excessive urination. In fact, by the time somebody is waking up 3 times in the night, especially in the night, and you have to go and pass urine, and the urine is not small urine, it's plenty urine, you'll be passing plenty urine. Then it is time to start checking that maybe something is wrong. Maybe something is wrong. Plenty of yeah, the person can be passing urine to a lot during the day, but because during the day we are not be able to like take note of the number of times we pass urine, especially men. Just go back to then go and come back. We forgot. But in the night, you have to wake up and go and pass urine. So there it is very it's very pathognomic. Then people get tired, just get tired unnecessarily, get weak, tired, and this tiredness is quite pervasive sometimes. Sometimes as bad as reducing your sexual activity. You do a few things, you get tired, you get finding yourself yawning, it's a problem. Then sometimes it can affect vision, where the vision becomes blurry. Suddenly you will just notice that, oh, things are blurred. And this happens a lot, especially when the blood sugar is very high. Then another thing, well, okay, I didn't mention it here, is people might lose weight. Just find yourself losing weight when you were not reducing your food intake, or you are not deliberately losing weight. We advise that people who are overweight should lose weight. But if somebody is losing weight without deliberately doing something about it, then it is something to worry about. Then, very importantly, also, wound will not heal on time. Wound will not heal on time in people who have diabetes. When they just have small cuts like this, it takes a long time to heal. In fact, the worst part is that they even have, especially when they have wound in their legs, in their toes, it will take a long time. And because it takes a long time to heal, it can get easily infected. The last part is that sometimes people feel numb. When I say numb in the feet and in the hand, that means they don't feel things. When they touch things, instead of you to feel it very well as you used to feel, it will as if there's cotton wool between your finger and that thing that you are touching. You know, it's like it's like it's like you don't have the proper quality of sensation, and this is also very bad, especially for the feet, because one can easily have an injury in the feet and you don't know, and that injury will not get healed on time, and when it doesn't get healed on time, it can now start becoming gangrenous, and when it becomes gangrenous, by the time you see it, SAT law, and then they might have to cut off that toes, which is a very bad thing. So those are there are many other symptoms, but I'm just going to keep to a very few ones so that we can move on time. Now, what are the risk factors? Who are the people that get diabetes? One is family history. If a family member has diabetes, maybe father, mother, or your siblings, or uncle or auntie, then the chances that you will have it is also higher. It's not automatic, but it's just higher because diabetes is genetic to an extent. You understand? So there are some genes that predisposes to diabetes, and one could have inherited some of it from their parents, or from their parents. So that is a risk factor. Then people who are obese, I mean, if you are obese, far above BMI, that is when the BMI is above a particular value. You understand? We now say that yes, we always say that BMI below 25 is the best, but by the time someone is getting to 35, you understand, the BMI is even above 30, really, even self. It's a cause for concern. Now, also, when somebody is physically inactive, that is, you are not doing regular exercise, that might be a problem. When you are always seated most of the time, and yeah, it might.
Sorry, can Adeogun and Abimbola mute? Thank you.
All right. Okay. So sorry, are we still with me? Yes. So, so of course, to people who are above 45 years of age, as people grow older, the chances of having diabetes is higher. And of course, because ethnicity, generally diabetes is higher among people who are black, who are Hispanic, Latino, but and then Indians. At least more than those who are white skinned. We are those who more than those who are non-African. We are more predisposed to having diabetes. So now, complications of diabetes. In fact, this is the reason why we are all afraid, because I said the blood sugar is very high in the body, and yeah, we are trying to use insulin to control it so that it comes to within normal, and that is 70 to 100. The reason, in fact, somebody will have asked, so who cares if the sugar is high in the body? So what does it mean? The reason why we worry is because it causes some organ damage, and that is why we are worried. If it doesn't cause anything, so enjoy your glucose in your blood, no problem. But because it causes problem, and number one is cardiovascular problem, it makes people predispose people to heart attack and stroke. You know, the thing about it is that excess sugar in the blood vessels starts to damage the blood vessel. That is, normally, we have a heart like a pump, and it pumps blood through like pipes, which are our blood vessels. That is the veins, the arteries, and our capillaries. But let's just keep to the arteries and veins now for ease of understanding. And blood is always flowing through them. When the sugar in that blood vessels is high, in the vein or in the artery is high, it starts to damage the artery, it starts to damage the vein. And that is where the problem starts, you know. And then it can affect the heart, it can cause heart attack, and it can affect the brain, and it can cause stroke. Then it can affect the kidneys, and in that one, the person might have eventually have kidney failure. And when there's kidney failure, we all know that this is a very big problem. Then it can also affect the nerves. As we said, that sometimes people don't feel very well with their fingers and in their toes because they are not feeling things properly. It is because the nerves that is supposed to carry information to make you feel things is affected. And once it's affected, the person is not feeling things very well. So it can lead to amputation due to loss of sensation in the limbs, and that can cause injury unnecessarily, and then the person can have uh, foot amputation. So also the last one I didn't mention is eye damage, which I so when the blood sugar is high, it can affect your eye, and that's why people come up with blurring vision, and it can eventually damage it, and the person comes with blindness. Then I talked about foot damage. Foot damage is because one, the nerves are not working well, so the person is not feeling, it's injuring his legs, and then because of course the body is not healing very well also, then that causes that problem, and therefore those two things, it can lead to foot damage. So heart attack, stroke, kidney damage, nerve damage, eye damage, foot damage, those are the problems that we have with it. How do we diagnose diabetes? We can do a test just to check your blood sugar. It's in fact we call it point of care test. It's just take one drop of your blood like this, palm into a machine, and blah, it will give you your blood sugar test. Usually we say that somebody should do it in the morning after fasting overnight. When we say fast overnight, that means the last meal you ate is maybe around 8 o'clock or even 7 o'clock, and you have not eaten any other thing. Just in the morning, we try to do it around 7 o'clock or 8 o'clock, and then we check. So we expect your blood sugar to be between 70 and 100 during that period of time. And when it is there, it is like that, we say that the blood sugar is normal. When it is above that, maybe it is doing between 100 and 125, then we say that the person is pre-diabetic. And when it is 126 and above, we say the person is diabetic. There are other tests that we do. We call it oral glucose tolerance test and then hemoglobin A1 test. Yeah, they are more of lab tests. But this fasting plasma glucose or fasting blood sugar test, very easy. You can even do it by yourself. Just one prick, bam, and then one drop of blood, and that is it. So, how do we treat these things? Um, how do we treat it? Yes, we do a lifestyle change. A lifestyle change is always the best way. So, who are the people who need treatment? First, those people who have pre-diabetics and those who have diabetes. You know, very, very important. Of course, those who do not even have diabetes too, they should do lifestyle changes. But I'm going to keep to my people who have pre-diabetes and diabetes now. Diet is one of the number one thing, and diet means that you eat normal size food, balanced diet. When I say normal size food, you know, if you eat a lot, if you eat plenty of food, just imagine all of that food is going to turn to glucose, or most of that food will turn to glucose. And as it enters into your body, it will increase the glucose level very high. And you need plenty of insulin to make sure that it controls it back to normal. And if you eat plenty of food, you need plenty of insulin. And if you don't have good insulin in the first place, either the insulin is not enough or it's not working well. So, of course, when you eat plenty of food, the insulin will not be able to handle it. But if you eat little amount of food, you know, that the total amount of glucose that enters your body is a bit regulated, then maybe the insulin that's not working well might just try and at least do the business well. And make sure it clears the excessive glucose from the blood system. And so that is why we always talk about portion control. Just take the right portion of food. I used to advise my people who are who have diabetes that don't allow your food portion to be more than two fists of your fist. If you look at your fist now, you understand, maximum all your food, everything in your plate should not be more than two two of your fist. Maybe your right and left should be there like that, and then you put a lot of vegetables, you put a lot of fruits. You understand? You take fruits 5 servings a day. In fact, I've been advising people now take fruits, different kind of fruits. In fact, try and plant fruit trees in your house. Like now in my house now, I have pawpaw, I have uh, orange, I have coconut, I have banana, I have yeah, and I have apple too. Yes. Then I have ugu. So having vegetables in your house so that you can always have to. In fact, I even have okra. I remember. You understand? Have vegetable in your house so that you can always have direct access because in Nigeria vegetable is very expensive. Then apart from diet, exercise, regular exercise. Now let it be a routine. Don't say that my work, oh, yeah, my work is physical activity. No, do exercise. And what we recommend is that do at least 30 minutes of moderate intensity exercise every at least 5 times in a week. That means that at least 5 times a week. So 30 minutes of moderate intensity. And what is moderate intensity? Moderate intensity is like if you are walking briskly, if you are walking fast, like if somebody says, I need to catch a train now, and you know that you are late, you are like 5 minutes late. You know the way you are going to walk, you're going to walk fast. In fact, one of the ways to know whether you are doing moderate intensity exercise is that when you are walking, you cannot sing. Even if you are trying to talk, you'll be catching your breath. Then you are doing some degree of moderate intensity exercise. And you can do it in any way. It can even be dancing. It can even be any way that you enjoy it. But I will not be able to talk too much about it because of this. So, food eating, portion control size, vegetable, fruits, exercise, it is key. Even if you don't do anything, those two are the most important. Then, of course, weight management is trying to lose weight, try to make efforts to lose weight. Also, that helps in controlling diabetes. And then the other part is that we take medication. Medications, I'm not going to talk so much about that. You understand? Medication include metformin, sulfonylurea, insulin, all sorts of medication. But I'm not going to talk so much about it. But what I will say is that if somebody has diabetes and the doctor says this is the medicine that you have to use, please use them religiously every day as it has been prescribed. Don't mix it up. Now, third one is monitoring. We need so somebody that has diabetes need to monitor the blood sugar, and it depends on the level of control. Some, when it is initially diagnosed, we might monitor up to once a week, once a month or so. But once it is stabilized, usually once in 3 months, once in 6 months, it's okay for monitoring. But if somebody is on insulin, you might even have to monitor on a daily basis. In fact, sometimes more than once in a day. In fact, when people are on admission, in some cases, we do 7 point measurement where you will measure their blood sugar before food in the morning, before breakfast, after breakfast, or 2 hours after breakfast, before lunch, 2 hours after lunch, before dinner, 2 hours after dinner, and sometimes before midnight. And sometimes it can even be continuous monitoring in more better climb. But what me I will say is that monitoring is so important, especially blood sugar. It's so important that even those of us who are not diabetic now, we need to at least once a year check your blood sugar. In fact, if we don't get anything from this our webinar, it is that I need to check my blood sugar regularly, and that regularly minimum once a year. Just go there. I'm sure the test is not very expensive, maximum 1,000, 2,000 naira. It cannot be more than 2,000 naira. That one I'm very sure. And that amount, 2,000 naira, is even not enough to take transport sometimes in Lagos of Nigeria. So just check at least once in a year. If you are doing it every 6 months, better still. But once a year, check your blood sugar because that's the only one way you will know whether yes, I am good. You understand? And if my blood sugar says I'm good, I will still keep my diet and exercise and make sure that I don't get too overweight. You understand? Of course, I won't need medication. If the person is pre-diabetic, then he knows that he needs to take diet and exercise more seriously and also monitor to be sure that the thing comes back. And I have a lot of patients that are pre-diabetic. When they take to their meal, to their diet regimen and their exercise regimen, they tend to come back to the normal value, which is between 70 and 100. And they do it a lot. And I always tell them, buy the machine. The machine is about, I think it will be about 15,000 naira now. You understand? You can just be checking. It has about 15 strips in it. You can buy more strips, about 50 more strips, and you put it in it, and you can check. You can just check. When they are pre-diabetic, I'll just say, just check maybe once in 3 weeks or thereabout, depending on how bad they are. You understand? And that is it. Especially, and I try to keep them and advise them to keep to their exercise as much as possible. So other things that we need to monitor: HbA1c, blood pressure, blood lipid. Yeah, we need to do all of that, but I'm not going to talk so much about it because my time is really, really gone now. But what is important mainly is keep to balanced diet, keep to good food portion, not excessive size. You understand? Do regular exercise. You understand? Monitor your blood glucose. That is for almost everybody. For people who are pre-diabetic and those who are diabetic, take your medication, and that is very, very important. You understand? The last part is, yes, self-management education, which is what we are doing now. Let us know about diabetes. Now we understand that diabetes has to do with blood glucose not being properly controlled. We need to bring it to normal. This is what we need to do to keep our diet. This is what we need to monitor ourselves. This is what we need to do to make sure that we use our to make sure that we use our medication every time. So it is self-education, and that's what we are doing now. And then, of course, it is also good if your close family friends, especially, or sometimes your friends too, if they get to know about it and they get to support you to remind you that ọ̀gbẹ́ni oúnjẹ tó ń jẹ yìí ó mà ti pọ̀ jù, ọ̀gbẹ́ni ṣé ò ní lọ ṣe exercise eléyìí, or have an exercise partner or somebody that will remind you of your medication or a healthcare system. You understand? And of course, all of these things will help us to prevent complications from happening. Because if somebody has blood glucose diabetes and is not taking care of it, then the chances of complications, which are things like strokes, heart attack, eye problem, foot ulcer, foot damage, nerve problems, all of those things can come up. So, when we are doing all of these things, we tend to prevent it. And I believe that in that little way, we we would have gone a long way in prolonging our lives. Not even prolonging our lives alone, but giving ourselves quality life. Some people are living and then we have many, many problems. But if you are doing the right thing, it will give you quality life over that period of time. And I believe that with the grace of God, we will live a healthy life in our middle age. We are all in middle age now, and I think I'm going to stop here and entertain as many questions as possible. Thank you very much. For those on board, thank you for coming. Bayo, Mumi, and George, somebody in Phoenix Mat 6, and someone in Samsung SM8225M. You're all welcome. We're all welcome. So, I will open the floor now for questions.
Okay. Good evening.
Good evening, George. How are you?
Fine. Good evening, everyone.
Yes.
There's an adage that goes this way: "You are what you eat." I don't know if anybody have heard that before. You are what you eat.
Yes.
Like most of the food we eat these days. For example, you buy a carrot today, the next morning it goes bad. It gets sour, or maybe it gets bad. You buy a pineapple today, and what's it called? Purple. Today
George, we're not hearing you. Hello? We can't hear you. Osuji.
It's about two. I'm reading an article about the food our forefathers normally ate. Most of the food they eat those days, they are going to extinction. Most of the food they eat those days, because most of those foods, the recipe they use to prepare those foods fights most of these organisms that causes cancer and some and some other stuff like that. So my first question, remember my first question, the fruits and vegetables we buy in the market, the garbages, the cucumber and all that stuff that they use fertilizers for, can we still go ahead to consume them? That's my question.
Okay. Thank you very much, Osuji. Thank you for the question. So issue about I'm not sure that we can do away with that with fertilizers, or because in Africa we have major food issues, and we cannot sustain ourselves doing traditional agriculture. So sincerely, we still need to use the fertilizers. Now, we will still get so much from those fruits and vegetables, even if they use fertilizer to produce them. You understand? We will still get a lot. Um, it's going to be hard for us to say that once it's fertilizer we can't use it won't work. It won't work. You need those fruits, you need those vegetables, and you need them to be on your table, and you need them to be as fresh as possible, and I think we need to live with what we have for now. You understand? So please continue to eat those fruits and vegetables. That's my conclusion for now. Now somebody asked a question about how many times should we urinate at night. You understand? By the time you're doing more than once, it's not right. It's not normal anymore. You shouldn't go to urinate more than one time in the night. You understand? Yeah. So somebody asked if fasting helps to reduce blood sugar. Okay, so when you are fasting, now it depends on the kind of fasting you are doing. When you are fasting, and generally you reduce the total number of food you are eating, you understand, your sugar will go down. But and of course, if you keep doing that, your sugar will go down, and that is the truth. However, the fasting that me I used to see people do, they eat in the morning, they eat at night. The Ramadan fasting, the amount of food that you eventually eat during the day is more than the number of food that you used to eat before. The only part is just that you don't drink as much water because you don't get to drink water during the day. So, in fact, studies have shown that during Ramadan fasting, the amount of food that is consumed actually increases generally. You understand? And then, of course, even some people who are doing Christian fasting too. You understand? I see them, you want to break at 6 o'clock and you give a long, big mold of food, which is almost more than maybe you used to eat like 1.5 times a day before, or you eat 2 times a day before. But the meal that you use to break your fast is 2 times what you eat normally. Then I don't know. You understand? You are still, because the whole idea about diabetes is that one. In fact, that one will even worsen diabetes, because the whole idea is that the amount of sugar, that the amount of glucose that I want to enter my blood from the food, I don't want it to be much at a time. I want it to be just moderate. I can even do it more often. In fact, I can even say, okay, instead of eating all of this food at one time, let me eat one half of it and wait another 3 4 hours and eat the other half of it. In that one, the amount of sugar that will enter your blood will be moderate, and therefore your body will be able to care, and the insulin that you have, which is not working well, will be able to care for it. So in that way, you understand. It is, if you eat too much at any time, it will affect blood sugar. Then there's a question that about if there is anticipation for sex and and you urinate often, is that a sign of diabetes? I It might be a sign of anxiety, actually, but we cannot. I think the best way to do is to just go and check. If you check your blood sugar, if it's okay, then you're good. If it's not okay, then you know that there's a problem. So that's very easy to to take to take note.
Yeah.
I'm going to take somebody is raising his hand. I think.
Yes, that would be me. Abolanle.
Okay. But
Yes,
how
I'm
are
good.
you?
I'm good, thank you. Okay,
Yeah.
so I have a few points highlighted here that I'll quickly try and rush through. But number one is going to be a question. Can you hear me, doctor?
Yeah. Sorry, no. I think somebody's. There's somebody's.
Olumide, can you mute? Olumide,
Doctor, you can mute him. Ayo, you go ahead and mute him from your end.
Okay. Okay. I've done that.
Yeah. Yeah. Okay, so I'm going to unmute myself. Okay, good. So right. For the urination thing and whatever, I am a heavy water drinker. So the thing is, I can take like 2 cups before I sleep in the night. So I know that is the reason for my going to the bathroom in the night. Like, because sometimes I go like 3 times, but I know I drink lots and lots of water. So I don't think I've ever at any point related it to diabetes. Even though with what you said, maybe I might have it checked, but I have never related with it with diabetes or whatever. And then I just want to chip in two things about what you have said earlier. Also, you talked about fruits and vegetables in Nigeria. For those of us that are here and are lovers of fruits and vegetables, there's one thing I found out. We eat more organic in Nigeria or in Africa generally than what we have in abroad. Believe me,
Yes.
you want to just wash those things thoroughly. We have the best fruits, we have the best vegetables. If you think storing it will make it, just go with what you have in the season. Buy as little as you can, or consume it and go for more. What we can do to prevent what his concerns were are that we can always make sure we rinse, if it's possible, wash them before we consume. It is possible they have wrapped it with cardboard. That is why if I had to eat, especially apples here, I scrape off the back. I don't eat apple. We can do that in Nigeria too because it is, it's like a preservation for them, for those fruits. So, like you said, we cannot, not eat because they are like that. And then I just want to encourage us, especially the men amongst us. I think that was what brought about that question you just handled now. The question of anxiety in sex and urination. In men, you see, these energy drinks we take, they are killers. They are killing our systems gradually. Not only does it facilitate diabetes and all other hearts, cardiovascular diseases and all, they are organ killers. I know some of us take them because we think, oh, it will boost my energy. It doesn't do that. It does more harm. They are cancerous. They are energy killers and all that. If we can do away with them, at this age, I think we should deal more with water. Hmm. Like, let's focus more on water. And then I appreciate your mention of your portion control. I think for me, it was one thing I never knew how to do until, and I noticed a lot of difference in me when I started doing that as well. Thank you for a well done job. That's it.
Thank you so much, Bolanle. Very wonderful. Thank you. Thank you. Yes, energy drinks are not so good. Like, I agree with you. The fruits also, scrape them, wash them, I agree with you also very much. Then about the water drinking and excessive urination. So what I usually advise is that if you want to drink plenty of water, drink it in the morning. You understand? Because sleep is also very important. In fact, sleep hygiene is important, so important that I try to say, let us limit our drinking late in the evening so that we can have a sound sleep. In fact, if you sleep well, you are likely to be healthier, and so what I would just ask you to change is move that drinking a bit earlier. It might be in the morning, it can be in the day, in the afternoon, so that you'll have passed all the urine you want to pass, and then you can sleep early. But most importantly, you need to check your blood sugar. Yes, sir, because we need to be sure that yes, this is just because if you drink too much, of course, you have to pass much more. You understand? However, in diabetes makes people thirsty to drink a lot, and then of course they make them pass a lot also. So we the only way we can know is to check. And that is, in fact, if we don't get anything from this topic, is to that. It's the fact that we need to check. Yeah, I think there's one hand raised up. I can't see it again. Yes. Oh, okay. Yeah, okay. I
Hello,
can't see it. Yes. Abimbola, how are you?
um,
Yes, I'm with
I'm
you.
good.
Yes. Yes.
Yes, thank you for the call. Thank you for the talk. Uh, it's well deserved and talk for the season. Let me just say for the season. I just want to ask about no, don't take, they will say, don't take this, don't eat this, don't do that, do exercise. We do all that. But what role uh, as hereditary parents, grandparents has to do with all this you are discussing? Because you have had that no matter what you do, if your parent has it or your grandparent, then probably you should expect it, except probably you are saying you are praying or so. So I just want enlightenment on that, from that angle.
Okay. So thank you very much. Very beautiful question, and I like that question, Bimbola. So the truth about it is that diabetes is a polygenic disease. Now, let me understand. Let me try and explain. It means that there are many genes that is transmitted from your parents that decide
Mm,
whether somebody will have it or not. However, it is not only the genes that decide whether somebody will have it or not. It also depends on the environment. And what is the environment? What you eat, just as George has mentioned it, you are what you eat. You understand? What you do with your body, whether you are an active person or an inactive person, and your weight control. So somebody might have some. So let me say now that in type 2, now maybe 30% is from your inheritance. You understand? And the remaining 40% or 60% is from your environment. And that environment includes what you eat, your level of activity, your weight. And then maybe another 20% or 30%, we don't know what is responsible for that. So in that way, so there are many things. So if somebody has the genetic proposal, maybe the father is diabetic, mother is diabetic, grandfather is diabetic, it does not mean that the person is going to be diabetic. Oh. If the person eats well, control his weight well, and does regular exercise, sincerely, he will not have it. Oh. So environment and what you do has a lot to do. So we can't say ó ti ṣẹlẹ̀ already wọ́n bàbá tí ní màmá tí ní wọ́n máa ní dandan nìyẹn. No, it doesn't work like that. In fact, there are many cases where parents don't even have it and the children will have it. Reason because lifestyle has changed. Our parents then they used to go to farm, carry things, walk long distance. We now we have cars, we have phones. We don't even switch our in normal television, you have to go during that time of box television, you go to the television and change the time, then channel 7, then channel 10, then channel 5, you can turn it, then you go back to sit. Now, if you don't have a remote, you won't even change television, you return the television straight. Or to some television now, you use voice to just say change channel. You don't even move again. So you can see that our lifestyle is very different. So environment plays a big role. Now, you mentioned something again, Abimbola, about don't take this, don't take that. You will notice that all through, I have not even talked about don't take this, don't take that. I've just talked about your portion size, your food size. You understand? I know there are some things that have high sugar content, and that when you take it, it will spike your sugar. But maybe like minerals, stuff like that. But on the general, me, I say maybe our normal food that we eat, maybe yam, pounded yam, rice, fufu. What I don't say people should not take it too, but if you take small, portion control, which is the most important thing. And I deliberately did not say, you should be eating beans, or you should be eating unripe plantain, or you should be eating. I didn't say that. I deliberately did not say that because I know that it used to cause confusion. Because if you sit down and you eat beans and you eat plenty of beans, you're going to have the same problem as the person who have eaten his normal rice. So please let us put that one in one side. Maybe things like Coca-Cola, things like what do we call it now? Carbonated drinks that has plenty of sugar. Of course, we should try and avoid that. But me, I also say that if I'm at a party and I just feel like taking a bit, I can just take a small portion of it. It won't kill me, But we try to avoid saying don't eat this, don't eat that. Yeah, there are some which like the Coca-Cola that I would say try and avoid, but generally our own African food here in Nigeria. I don't know about maybe you're abroad anyway, Shannon, because abroad has a lot of different food, but our own here, I always still say that let us eat our normal stuff. Just make sure that the portion size is okay. If you have to eat pounded yam now, if you take one feast of pounded yam like this now, and just put maybe plenty of vegetables that will be bigger than the size of the yam, you pounded yam very nicely. Yes, and make sure that you take fruits and fruits too along with it. Oh well and good. Life is good, and things will be so more of portion control rather than this. Don't do this. Don't do that. Two, because you have hereditary inheritance does not mean person will have it. Environment plays a big role in it. I hope you are good with that. I think Bayo raised his hand, and then Juliana thereafter. Bayo, you have the floor. Adebayo.
Hello, can you hear me
Yeah.
now?
How are you,
Hi,
sir?
good. I'm good. Are you?
Very long time.
Yeah, long time, my friend. um, this is a very good topic to treat, and is actually something to to really work towards. Um, my question: the medication test and management, how affordable it is? And I'm looking at the general context now because on this group, I mean, we are more than 13. And as they used to say, Ika Odogba, some people might have it, and they might not want to talk about it. And is there any way they can be like a way to subsidize the treatment? Because I know some people might not be able to afford the treatment, which I don't know how much it's going to cost anyway. But we're just talking in general terms now. Let's see if there is a way to meet the treatment of those who suffer it, and to make it affordable for them to manage. That's my question, please.
All right. Thank you very much, Bayo. Very, very good. Thank you. Very, you have thought several steps ahead of us already. but, but that is very good. Actually, the mainstay of treatment of diabetes is actually the food food control, and exercise. And then, of course, weight loss. That is the number one. In fact, baseline, everybody must do that. You understand? So usually what we do is that somebody, we diagnose somebody either pre-diabetic or diabetic. We also first of all say start that. You do that for 3 months. If we are not seeing any progress, then we say we need to introduce medication. And the medication, so they have levels. You understand? We start with metformin. We call it glucophage. Is a very common medication. So that is metformin itself is not that expensive, but generally everything in Nigeria is expensive. So let's just let's just put it that way. But
Exactly.
it's still sort of affordable. But this is where the problem is. Oftentimes, one medicine doesn't cut it. So this is the way we work. We say everybody do exercise and food. Then if that doesn't work, we add metformin, which is the cheapest drug, with exercise and food. If that doesn't work, then we add another layer of medication. Then if that doesn't work, then we add another layer of medication. So the number of medication that the person uses is will increase over time. So what is number one, which is exercise and diet and weight management is one. The person will continue to do that. What is number two, metformin? He will continue to do that. What is number three, four, five? In fact, I have a janitor at where I work now, and he's on what we call it now, Jadis. Jadis is it's one of the new medications that came up, and each 1 month supply will cost about 60,000 naira for that Jadis alone, and it's just one of his medication. In fact, by the time I pack all the medication that he needs to use for the month, it's roughly like 120,000 naira. Yes, sir. But unfortunately, his own case is a very bad case. He's just not responding. He has hypertension, he has diabetes, and everything is just bad. And he's still a very young person. In fact, he's under 40, I think. You understand? You know,
Mm.
and so each person, it depends on the level of control that we can have, and thinking of a way of subsidizing it. I think it's not something I can answer in this forum, because we need to get to a level where you know we diagnose. We really need to think about it, but I think I'll take note of it and I will work on it. But majority of people will do well with exercise and the initial medication, which is metformin. Some patients are very bad that they have to go back to daily injection, and daily injection is a bit expensive. Daily injection of insulin. But I think we'll I will work on that, and then we'll get back to you on that.
Yeah, that's good. Thank you.
Thank you very much, Deji. Then Juliana, I think your hand is still raised. She's on.
Yes. Sorry, doctor. I have a question. For
Okay.
someone who have diabetes, pre-diabetes or diabetes, and then you're controlling it with probably insulin, weekly insulin. Let's say you're using Ozempic, and then you have daily metformin for like about 500 milligram. You take in the morning and you take in the evening twice daily. Now you check after taking metformin, after taking Ozempic, which is supposed to be once a week. Maybe let's say, for instance, you take it on Mondays. Now you check your blood sugar, because you have to check your blood sugar before you take your metformin. Now you check it and you see that you are kind of very, is it low now or high? And if you take the metformin, yeah, you are low. And if you take the metformin, you're going to go lower. Is it okay to skip it, or what do you do?
Okay, thank you. Very good question, though. Very good question. Though a bit complicated, but you see, the issue now is that this person, once it's on insulin, it's not pre-diabetic anymore, it's diabetic, and it's not a well-controlled diabetic that require multiple medication. As I said earlier, we start with this baseline, and then level one, level two, level three. So by the time you are using Ozempic, the control is bad. I mean, the person had used all the gamut of medication. So that's that number one. So it just shows that that person requires some form of medication always. Now, what is the risk of using medication? Sometimes it can be too low, and then the person will have hypoglycemia, that is low sugar, and that might cause problem. However, that is usually due to some medications like Ozempic, especially that weekly injection, because it is a form of whatever. So it's those are the ones that are likely to have hypo from those medication. But medication like metformin, because what metformin does is that it just goes to the liver and ensure that the liver is properly controlled. It doesn't release excessive glucose at any time, so that we don't have any. So me, I used to tell my patients that except the blood sugar is very low, always use your metformin. Don't skip metformin. The one you can skip now is Ozempic, which you even use once in a week. But I still think that metformin, I will hold on. I will continue to use it, except the sugar is very low. If it is normal, if the blood sugar is normal, I will use my drugs as I should. That is both the metformin and the Ozempic. But if it is low, and it depends on what low we say is low. If normal is 70 to 80 or 200, and the person is at 70 or at 65, you understand? I will still use my metformin. I won't stop, because this person, his control is bad, and that's why he's using all of this medicine. You understand? If he doesn't use it, he will not get well. Yeah. So that's the short answer that I will give to that. But of course, this kind of case really requires specifics.
Yeah, but sorry, I think I should have an add-in. This person, when she uses the metformin, if the blood sugar is less than 100, you find out that the person loses strength and blurry, which is still the signs of the diabetic. That's the first question. Now, the second question is, I have someone who is diabetic, hypertensive, and recently had a stroke, the brain stroke. Now,
Okay.
how does that person, is there a way the person can control the diabetic part of the um, uh, signs or diabetic aspect of the sickness, that he doesn't have to poke himself with insulin all like 3, 4, 5, 7, up to 7 times a day? Is there a way just to avoid another pending stroke?
Okay. So thank you very much. So the first part, just losing strength. What do you mean by losing? Is it losing strength in that whenever they use the medication they lose strength, or they lose strength before using the medication? I didn't get that part.
They lose strength if the blood sugar is low, not up to 100 and above, and then they use the metformin. So it's like the metformin makes normally the metformin is to reduce the blood sugar
Yes.
level. So now, if it is not up to 100 and the patient uses it, eh, before you know it, she's complaining
Okay.
that she's losing strength and
Okay. I
the
get I get
vision
I
is
get
blurry.
I get what you're saying. So that means that that person should not use that medication. They should go and review the medicine. Yes, either they will be on a lower dose, or an alternate dose, or an alternate medicine. It shows that the person is having side effects of the medication. You understand? And it's best they find a way of resolving it. They really need to rejuggle the medication, so that solves that. Then the second one, of someone that has hypertension, diabetes, and stroke. I mean, that has hypertension. You see, the person that has stroke already is a complication of diabetes, and now the fact that he has hypertension, so hypertension itself is a problem. Then now having hypertension and diabetes is a double problem, double barrel problem. Now having stroke again is like triple barrel problem. So in this kind of patient, we need to control the sugar very closely. We will not even give room for any change. So what I will say is that this person has to be on insulin regularly. But what the best way is that they can use all this, there's this there's this, what do you call it, insulin implants, where you implant it on your body and it gives continuous dose of insulin. Or there's one of my patients that I saw this meter, and then that meter will measure their blood sugar, automatically inject the amount of insulin that they require, and it does that automatically, so the person doesn't have to worry about it. And so maybe this kind of patient, if they can afford it, if they have the health insurance, then that might be the best way to go. You understand?
Sorry, can you reiterate that? Can you reiterate it? I'm
Yes.
just trying to get it clearly. Uh,
Yes. It means that this person needs regular insulin injection. You understand? So if they cannot give it, giving, by, we have pen to give injection and stuff like that, then there is this insulin patch or insulin pad or insulin. I can't remember the name itself now, but I know that it's a device that you put on your skin and it measures the blood glucose in the body and decide the amount of insulin that the person needs, and it will inject that amount of insulin. You understand? And to keep the blood control. But it's a bit expensive. I'm not even sure insurance covers it. You understand? The person probably will have to pay for it. The person has to request for it because it depends on the level of insurance that he has to be able to have access to such things. But I've seen a couple of my patients who came from the US who have it on them. You understand? We don't use it in Nigeria anyway, so because we can't afford it, you know. Yeah, so but yeah, they do have that. That might give a better control. But the issue is that this kind of person needs power, it needs strict control. Strict. When I say strict, they need to give that injection as regularly as required. I hope you got that now.
yeah, I got that. The problem why the person was asking is because the person is thinking of retiring back home. The person stays here, but is thinking of going back home to retire, or thinking about the cost of having those insulin back home. Is looking at, is it possible to reduce the amount of insulin that he gets, while so that when he goes back home, he's not having problems or financial problem of getting the insulin and all that.
That's a tough one, really, no, because the truth about it is healthcare for the elderly, because there's insurance abroad, it is better there to an extent. If you have to do it in Nigeria, you have to have a lot of money. There's no health insurance. So if you do not have that deep pocket, the person will run into trouble. But if he has a deep pocket, we can manage it well here. You understand? You will probably need insulin. You will need a form of you will always need constant power supply to preserve the insulin. It's not going to be it's not going to be without money it won't work. Let's just look at it that way. Without money it will not work. It won't work.
So, Doctor, sorry, the last, so finally, would you say that it's just better for the person to control the diet and that's it?
That one will not work also. You understand? He has passed the level of only diet alone. He needs to use medication. Otherwise he will die very soon.
Thank you.
You're welcome. Now somebody asked a question about if it is okay for somebody to take water at midnight. You know, so I think I've touched on it a bit earlier. So me, I always advise that don't drink too much water at night. Why? Because you're gonna pass urine. Why will you pass? And if you go and pass urine, you will wake. It will break your sleep. And once it breaks your sleep, some people, as you grow older, sleep is not it's not that easy like before. When you were small, yeah, once you're tired, like you sleep over, that's it. But as you grow older, sometimes you find nights that you are finding it difficult to sleep. And once you don't sleep well, the following day is messed up. There's no way about it, the way you are going to go about it. So, me, I always advise that for our age group, sleep hygiene should be top notch in our mind. Before I go to bed, I have my bath. I make sure it's cool. If I can have a air conditioned room, all well and good. If not, try as much as possible to stay in a cool place. Make sure the noise level is down. Make sure the light is low, so that I can have sound sleep. You understand? Sometimes I can say, okay, have soft meditating kind of music so that you can sleep well. Because sleep is healing. Sleep is good. We don't play with sleep. So personally I advise don't drink water at night. You understand? Now it is not that the water itself is bad, you know, it is not that it is the one doing the problem, but for some people, when they drink at night, it makes them to pass urine a lot. And once you start passing urine a lot, you have disturbed your sleep. And maybe another time we'll probably talk about sleep hygiene on this platform. You understand? We'll talk about sleep hygiene. We talk about sleep hygiene on this platform, and that will help us to learn a lot about this. Sleep is important, very important. Don't play with it. And I think yeah, so I believe I've answered that question. Yes, 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 yes. Do we have any other question? Do we have any other question? I think that's, yeah. Okay, George is back. I'm trying to check the message section if they have any other question. Okay. Yeah, I'm not sure we have anyone. So I don't know if we can call it a day, and I don't know if we're able to, make anything out of this our meeting.
Can I talk?
Yes.
I just wanted to say it's been a very, very information packed webinar. And personally, I'm glad that I was part of it. And I want to say thank you very much, because this kind of education is something you pay to get, but we got it free. Yeah. So thank you so much, Dr. Ayo. We appreciate you for that. A lot of us have the diabetes. Some of us have pre, some of us are real into the diabetes, and some of us are way gone. But I think hearing it from one of us now would retrace our steps and actually do something about it. And I want to advise some of us who think, well, èèyàn kan máa gbàbí kan kú ṣáà ni one way or the other you die. I think we should have a rethink. There's a lot of reason to be alive if you are opportuned to be. Let's not use our hand to send ourselves down the grave too fast when God has not sent us. Thank you. And thank you to everyone who was here.
Yeah. Thank you very much, Juliana. Thank you, thank you, thank you. Any other comment from anybody before we call it a day? Yeah. Okay. Bio?
Yeah, Doctor,
Yes.
thank you very much for this webinar. It's highly educative and interactive as well. As you've said, you've touched so many points, and I think the best thing is for us to utilize it and keep up to it. The reason why I asked that question earlier was that since I'm in the UK, since I've been in this country, I've never seen a doctor, but they keep writing me a letter to come for a checkup. So I went to see the GP, and they checked my blood pressure, and they asked me if it's too high. Really? So they gave me a monitor. Sorry, I'm trying to get off. I'm sitting there. So they gave me a blood monitor to use. So when I go, my missus, she's a nurse, a dialysis nurse, and she was trying to carry out one on me. Now realize that actually the doctor did it wrongly, because I had my hand dangling down, and the doctor carried it out, and it was high. So my missus asked me to raise my hand to the heart level, that my hand need to be at a particular level for it to get a good measurement. And the test kits, my two finger need to not too tight. You know what I mean? Not too tight. That I should be able to put my two finger in between. And voila, she did it. And it wasn't high. So it actually beat my imagination for a doctor working in the for NHS to have carried out a test, which is like giving me like a panic attack, you know? So that's why I said, if there is a way, because people might not want to come forward to see whether they have this thing, you know? And if eventually they do, how are we as a group, you know, going to try and
Support
meet
such people.
the year to subsidize, because I know things are very, very hard in Nigeria. Very, very hard.
Yeah.
Talking about portion of food, and some people doesn't even have two square, 3 square meal in a day. You know what I mean? And when you have having one, that one you want to eat it as if there's going to be tomorrow. So it's been good. I really enjoyed it, and we look forward to more of this. And thank you for it. We really appreciate it. Thank you.
Thank you so much, Bayo. I mean, I can understand the disappointment that you have felt with the NHS, but
Yeah.
they're a bit overwhelmed now. And again, it's possible that you had what we call white coat hypertension. That is when your blood pressure is high when you're with the doctor, and then it is normal when you're with your loved ones. Or at home. Yeah, so that does happen too. In fact, it does happen a
Okay.
lot. Yeah, but don't worry, we'll talk about that one later, really, so that we don't, because it's now like another topic. But the
I
important thing
know.
is that it is good to do a regular check. Even if
Yeah.
it's something is wrong, we can go again and we check it and we check it. Now, on
Yeah.
the issue of us here, though, the only thing, it's a bit tough, but you know, probably when we are gathered, maybe we can do our HbA1c. Yes, and that might give us an idea. But
Yeah.
it's also, it's just like the logistic of that is also a bit one kind, because I know that normally, this blood test now. I mean, I'm talking of BHS members now, that okay, maybe we can do for all of them and know,
Exactly. That's actually where I'm coming to.
yeah,
Like, if you
yeah,
can do a
I
group,
get it. I get what
mm,
you're saying, but you see, the issue is that blood sugar test, the one that is just that pinprick and one drop, that one should be done in the morning before anybody eats. And to get people together in the morning before they eat is a tough one. You understand?
okay.
So the only other test one can do is maybe HbA1c, and that HbA1c will require a bigger machine, which is not so mobile. Though it's available, really, though one can get it. It's a more expensive test, but one can do it right there and there at any time, and then you can decipher whether the person has blood sugar or not. In fact, it's even a better test than the fasting blood sugar.
Yeah.
Just a bit, but it's something that, well, maybe we can consider it, maybe when we do a reunion or something like that, or when we do a meeting, where
Exactly. Things like
also
that. When there's gathering of
people,
everyone.
yeah, get people
Mm,
to check specifically. But it's not as straightforward as that. I would think about the logistics. Yeah, I would think
yeah.
about
I
the
mean,
logistics.
you guys, the ESCO, you can at least think about it and see. Let's see the way we go about it. If it
Yeah,
is something
yeah,
to,
yeah. It's something that we
yeah,
can. We can
mm,
Yeah, it's some, at least the blood pressure we can do that one anytime easily,
yeah.
but the blood sugar is the one that is the challenge. But we'll think about it and find a way of going about
All
that.
right, Chief.
So thank you
All
very
right.
much,
Thank you
Bayo.
so much.
We
Thank
are
you,
so
Chairman.
so grateful. So what one important thing I just want to remind us is that we want this webinar to continue for as long as possible. Last Sunday of every month, we want to continue. And we want people to volunteer also to teach us. I mean, we are hoping to do something on finances next month. We are yet to find our speaker, but once we find a speaker, we will be able to like announce it so that everybody will join. Because I mean, this is the time a lot of us are preparing for retirement one way or the other, if there is anything like that anyway. You understand? But I would love to improve my financial standing in whichever way, and I hope that we can have somebody speak to us on that and will help us on that. And then of course as many things as possible. So please, I want us in our mind think of things that we have expertise in, that we can actually teach, you know, others here. And, even if it is as simple as trading, you understand? If you go there, if you trade, you'll be able to make this amount of money, and even it's something small. Please, let's just think about it. And even if we can invite other people who are non-members of the association, who you know that they're your friends, you can actually drag them to come and teach us. We'll try our best to be as many people to listen and take good notes and learn new things. So that's just what I want to implore all of us, that please let's continue to think about the webinar. Let's continue to think of how to improve it. Let's continue to think about the topics that we can actually, discuss. And then, and yes, let's move it forward. Bayo, you are welcome. I think no, that is Bayo of US now, Abby.
No.
No, there's one Bayo that just joined us
Yes,
now.
yes, yes, yes.
Uh-huh.
I just
Bayo of
joined.
US. You are welcome. Eh?
Sorry, I just joined now. It might be no.
No problem. Well, we're about closing now anyway.
No problem, no problem, no problem, no
So
problem.
no, no. So maybe you should give us a closing remark and then let us go.
Close. Me?
Yes.
Which remark? I just joined now. Anyway, okay, let me give the closing remark, Sha.
Yes.
I want to thank everybody for joining this the first webinar for the group. And I want to thank the convener too, our president, Dr. Ayo, for all your efforts. We really appreciate all that you're doing, and we appreciate uh, this new opportunity you are giving to us to learn more. May Lord continue to grace to give you the grace to continue to do it in the name of God.
Amen.
I want to encourage everyone also to let's find time to always join. Don't I apologize for for joining late. It's just because of my schedule, but then that is not I'm not giving that an excuse, but then I apologize all the same. So thank you everyone, and God bless you all.
All right. Thank you very much, Bayo. Thanks everybody, and thanks Bayo in UK. Thanks Ojekide, Morafa, George. I think Nene is online. Olawumi is also online. Yeah, thank you very much. Abimbola, Victor Gongo,
Thank you.
Bolanle, Juliana, and our patron, Debola.
Thank you for the lecture, doctor.
Yes. Hello, Abimbola.
Thank you very
Abimbola.
much.
Yeah, yes, yes,
I just thank you for the lecture, doctor.
yes. Thank
Please,
you.
is
Thank
this
you.
Abimbola? Is that Runshewe Abimbola?
No, Olubukola Lawansin.
Oh, okay.
Mm. Thank you for your time. Oh, the Lord bless you.
All right, so we see you very soon. All right, bye bye, everybody.
Bye.
Bye bye.
Hi, thank you very much, Doki. We are
Yeah,
very
thank
grateful for the
you.
presentation.
Yeah, Jackie. Okay, that's true. I wanted to say you are quiet. I forgot that you were the one that asked many questions on.
Thank you.
Jackie,
Yes, sir.
how worry now? Eh?
Worry deal. Worry
Eh,
day.
this
Worry.
man, you know they come Lagos at all. It's as if you don't forget Lagos completely.
No, I dey call once in a while.
No, you don't. You don't.
No, I dey call now. I dey, I dey, I
Ah,
dey, I dey sneak in the, I dey sneak in the sneak out now.
We have to look for you then. No, maybe whenever you come to Ibadan, just remember to call me. Eh? If you have a
Of
course,
course, I will. I will.
but it's not that Benin is not a
I,
place that I
I,
come at all. Mm.
I know. I know. No,
Okay.
Allah. I will
All right
definitely look
then.
for you now.
Okay. Okay.
Thank you very
Thank
much.
God. I even recorded this thing, so hopefully we should be able to maybe send it to people.